Hello. Thank you very much for this opportunity to be able to talk to you about global surgery in the era of climate change and planetary health. I'm pretty sure that right now, in the middle of this pandemic, we are still very much concerned about perhaps not just the first wave or the second wave, but future waves of COVID-19 and Omicron-like surges. But I think we should also be concerned and perhaps even worried about not just future waves, but also future tsunamis of climate change and biodiversity collapse and all their myriad health consequences that will be happening that are already happening right now and will be happening in the years and decades to come. And so as a physician myself, I always see my work as treating not just one kind of patient, but two patients. On one hand, you have this kid wearing a face mask, attempting to protect herself from the unseen coronavirus. On the other hand, you also have Mother Earth, herself wearing a face mask, of course, not to protect herself from COVID-19, but instead to safeguard herself from the myriad ecological damages that we are inflicting on her because of our many different activities. And so I think that now we live in the era of planetary health. And in planetary health, as I've said, we now have two patients, people and planet. And one of the central challenges or issues in planetary health is the existential threat of climate change. The climate emergency will undoubtedly impact the health of human populations. As you can see in this diagram, there are many different pathways that connect climate change to human health. Climate change can affect health through storms and drought and flooding and heat waves. And all of these phenomena will generate a wide variety of health impacts. And as you can see in this diagram, there's no single disease group that will be immune to climate change. You can think of infectious diseases like mosquito-borne diseases, food-borne diseases, water-borne diseases. They're all going to be affected, impacted by climate change. Also, chronic non-communicable diseases, heart disease, lung disease, especially as a result of exposure to air pollution. That is also another kind of impact of climate change on human health. Nutritional gains are expected to be reversed if climate change will not be averted as soon as possible. And there's also growing evidence that climate change will also be affecting mental health of the global population, whether through extreme weather events like typhoons or flooding or other climate-related disasters, or the slow onset climate anxiety that is generated by the growing uncertainty in this era of a warming planet. And while the health impacts will be felt, experienced by every country in the world, these health impacts are also going to be unfairly distributed, unfortunately. In this classic map that is published by the WHO, you will see that at the top, there are countries that have emitted the greatest amount of greenhouse gases into the atmosphere. They're the ones that are enlarged or magnified at the top map. North America, Europe, and more recently, China. But at the bottom, you will see the parts of the world that will be bearing the brunt, that will be suffering the consequences of climate change. That is Africa, huge swaths of Asia. Unfortunately, the Pacific Islands are too small to be magnified in this map, if not totally erased from the face of the Earth because of continuous sea level rise. So as you can see here, the perpetrators of the climate crisis are different from the victims, the ones who will be impacted greatly and disproportionately by the health impacts. And in my home country, the Philippines, over the past 2 years, we've seen the confluence between these two crises. the COVID crisis on one hand and the climate crisis on the other. If you are a poor Filipino, perhaps living along the coastlines or in rural areas, you are confronted with a dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus? But perhaps my house will get inundated by intense flooding, or perhaps the roof of the house might be blown away by the strong wind. On the other hand, do I move to these cramped evacuation centers, these temporary shelters, safe from climate-related disaster? But as you can see in this photo, there's no social distancing to begin with in these locations, and therefore, there's a very high chance that one will be contracting SARS-CoV-2, COVID-19. And so this is a real dilemma faced by people who are at the heart of the climate crisis, living in this era of COVID-19. And so right now, the global health sector is beginning to contemplate, re-examine what is our role in addressing climate change and protecting and saving lives in this era of a warming planet. And one of these sectors that have been having these reflection, internal reflection, is the field of surgery, the surgical field. You will see here several titles of articles contemplating on the role of the surgeon, what can be done inside the operating theater, what is the environmental impact of surgical practice, okay? How do we make sure that surgery is adaptive and resilient to the myriad effects of climate change? We know that surgical services will be disrupted, if not destroyed or totally stopped, if climate change and its related environmental and health consequences will continue to worsen. So these are just some photos of hospitals, health facilities, surgical rooms or theaters included, that are affected by inundation, extreme flooding, or destruction by typhoons, hurricanes, cyclones. And of course, when these disruptions occur, and also when climate change continues to worsen the living conditions, especially of the world's poor, their access to healthcare, livelihood, etc., then we can anticipate that the existing inequities in surgical access will continue to be worsened, exacerbated. The gap, instead of being closed, will be further widened. And so it's very imperative, it's a huge imperative for the surgical community to start acting on the climate, to start including climate change into its operations. We've seen during this pandemic that our healthcare systems, including our surgical systems, are in a state of shock. We're not ready for a pandemic, and more so, we're also not ready for long-term climate change and other types of shocks and stresses. And so the question that we should be answering now is, are we ready to build health systems that consider the climate? Are we ready to establish surgical systems that are oriented towards planetary health? So in terms of preparing for the impacts of climate change, making sure that we are able to adapt and build resilience, there are many things that we can do in the field of surgery, in the surgical community. Here, and this is from an article published in the Lancet Planetary Health in 2020, you will see the different arenas where surgery can incorporate climate resilience into its planning and operations. We can think of the infrastructure. How do we make sure that surgical theaters, rooms, departments are the last department or last building standing in the face of climate disaster? How do we prepare our health workforce to become adaptive and responsive to the impacts of climate change, making sure there is a steady supply when a typhoon or an intense flooding does occur? How do we make sure that the services do not get disrupted. And perhaps there's a role for telesurgery to make sure that surgical services are sustained, retained, despite disruptions related to climate change. How can we create financing mechanisms that are climate proof, that will make sure that surgical needs, among others, are continuously funded, not just for some people, but for everybody? How do we incorporate climate information when we plan and create health information systems? And ultimately, how can we make sure that climate change is a prime consideration at the level of surgical governance? So these are just some of the many things that we can do within surgery in order to adapt and respond to the climate crisis. But we must also remember that healthcare, surgical care included, is also emitting greenhouse gases into the atmosphere. Unfortunately, we are also part of the climate crime. In fact, there is one estimate done finding out that around 5% of the global greenhouse gas emissions are emanating from the healthcare sector, including surgery. And there are different types or different sources of carbon and other greenhouse gases in healthcare. They can come from our energy use. They can come from the way we travel and the medical devices and pharmaceuticals that we purchase, or the food that we serve to our patients and staff. So all of these are generating carbon and other greenhouse gases, and therefore we are also an emitting sector. There is one study that examined the carbon footprint of different health services, and this is just an example, and this is just a sampling. And you will see that there are several surgical procedures that emit a lot of greenhouse gases into the atmosphere, carbon in particular. And therefore, there is a very strong case for improving prevention and early detection, and also more efficient provision of surgical services in order to reduce our ecological footprint. There's one study that examined 3 operating theaters in 3 different hospitals. And as you can see here, the majority of greenhouse gas emissions is coming from the use of inhalational anesthetics, anesthetic gases, in particular desflurane. And you will also see that energy use is also a significant source of carbon. In fact, in this study, it was found out that operating theaters tend to emit carbon, volumes of carbon that are 3 times to 6 times greater than the amount being emitted by the entire hospital. And that is because of the intense or the carbon intensity of services inside the operating theater, which require ventilation, heating, and air conditioning, for instance. I already mentioned a while ago desflurane being the most climate disruptive of all the inhalational gases, because it has a very high global warming potential. And so even the community of anesthesiology is already starting to look into these types of anesthetics and how to reduce the carbon emissions coming from anesthesia, and instead use more climate-friendly alternatives that are also healthy and safe for our patients. And so I already mentioned the many different things that healthcare, surgical care included, can do in order to reduce our emissions, our carbon footprint. And I invite you to visit this website, to Google this agenda, the Global Green and Healthy Hospitals Agenda, which laid out 10 pillars in which we can embed sustainability into healthcare. For instance, in terms of waste management and the use of energy, the procurement of food and pharmaceuticals and other devices, and in terms of the building design of our healthcare facilities, including surgical facilities. So I already described to you the dual responsibility of healthcare, including surgical care, in terms of reducing our own emissions, greenhouse gases, carbon, and also preparing our sector to respond and adapt to climate change and its myriad health impacts. And that is why this new concept called climate smart healthcare has emerged. Climate smart is a convergence of sustainability and resilience, of mitigation and adaptation, of lowering our footprint while at the same time preparing for the health impacts of climate change. And in fact, in a recently concluded UN climate change conference that happened in Glasgow in late 2021, more than 50 countries made a commitment to establish climate smart healthcare systems in the years and decades to come. So during this pandemic, we have seen this graph. We have been constantly reminded that we need to flatten the curve of COVID-19. And we need to do it in order to not violate or breach the healthcare system's capacity, to not overwhelm the healthcare's capacity. And we're also asked to increase and elevate the healthcare system's capacity by adding more beds, recruiting more nurses and doctors, and rolling out more vaccines. I think that this mantra of flattening the curve also applies to the planetary health crisis, the climate emergency that we are currently facing. But unlike the previous curve, in this curve, the Earth's capacity is constant, it's fixed, it's unchangeable, and therefore it's non-negotiable. And therefore, the only thing that we can really do is to flatten our curve, the curve of our ecological footprint and our carbon emissions. So I hope that planetary health will serve as a guide to our post-COVID recovery. We want to make sure that after this pandemic, we're able to build a green, healthy, and just future. And I hope that the surgical community will be part of this campaign, of this agenda. I think planetary health is also an invitation to planetary humility. We are being asked to shift away from this ego-logical perspective, where we see ourselves as being at the top of the pyramid of nature. We can kill, consume, pollute, extract, mine, produce endlessly, as if the planet does not have limits. Instead, we are asked to shift towards a truly ecological approach where we human beings live in harmony, in greater interdependence and solidarity with creatures great and small, and all the other components of planet Earth, our only home. Together, let's advance the health of people and planet. Thank you very much for this opportunity.